Health Department is under growing criticism for its failure to track the nationalities of patients at public hospitals, a gap that experts say undermines effective healthcare planning and resource allocation. Now, with tensions rising over claims that foreign nationals are straining the system, Dr. Kgosi Letlape warns that the lack of data makes it nearly impossible to budget properly or ensure adequate staffing and supplies at already overburdened facilities. Just last month, Operation Tutola activists attempted to block non-citizens from receiving care at hospitals in Durban and Johannesburg, citing pressure on services meant for South African citizens. Dr. Letlape joins us now to unpack the implications. Dr. Letlape, we've certainly been seeing a whole host then of tense moments, shall we say, outside of our national health services then as well. But you feel vindicated that indeed, if we do not have the data of who the nationalities are using our public health service, we won't be able to budget properly for it. Hence, we're seeing the struggles we're seeing right now.
It is really astonishing that you could have a government that is not prepared to know what it is doing, that is not prepared to collect basic information so that it can inform proper planning for the services that they provide. There's a blind spot that no one can explain on these matters. And it might be people just don't care. You know, there's no duty of care to those that use those facilities for their care.
Just detail for us again, if you don't mind, just why it's so important for us to be tracking that kind of data, because clearly it hasn't been done for a reason. We may not necessarily know the full reason behind why that is, but that may be at play right now. So why would this be so significant for us?
Well, it is significant because you have policies in the country in terms of sorting out who should pay for services, who should get free services. That can't just be done randomly if you are not collecting essential basic information from a person that is using your facilities. Locals, depending on their circumstances, don't have to pay. People that come from outside, you need to raise an invoice for them to be so that they can settle their bills before they go. There are categories of patients that are not entitled to free services. And remember, just in terms of international norms, people from outside should make provisions for how they take care of themselves. Permanent residents have the same rights as citizens, but all others should have made provision for healthcare services in case they need them before they are allowed into the country. Now, when all those things are put by the wayside, you then have chaos. You then have the services being overloaded. You have professionals being overburdened. You have people that can't cope. You have healthcare professionals that are stressed, that are burnt out, and all the issues of the poor quality of services then arise from people that are overburdened because they have employers that don't come to their assistance.
With the better data, we'd be able to budget more, is also one of the things, even for the increased numbers if they need to be at play. One must also add that, 300 billion rand that we put forward to our health services? It's 11.5% of our budget. It is still a very significant figure. Should it be better used as well then, which would then maybe change the situation?
Well, it should be better used. But remember that nearly 20 years ago, at the Abuja conference, an Abuja declaration was made that encouraged governments to make sure that they could move towards spending 15% of government expenditure on health. If you don't view health as an investment, you end up not making proper provisions for it. Now, health is wealth, and health should be seen as an investment. So given the size of our population, the budget we have is not sufficient for quality healthcare. When you now open the services to anyone that lands on your doorstep, the situation becomes aggravated. The issue that we always talk about of drug stockouts, it's not surprising when you have too many people using the services. Now, when you do not collect information, you are not able to plan properly. You are not able to tell the government that based on usage, this is our needs, this is what we've used last year. Can we please be funded properly? We're always talking about our departments having accruals, our department running out of funds, having services provided and promising to pay service providers with the next cycle when they get new funds in a new financial year. That is poor planning, that is indifference, that's lack of care, that is not taking their jobs seriously. And I think part of the problem is that we as public officials don't use the same facilities that the majority of citizens use. That's why we are indifferent to what is happening in those facilities.
That's a very fair point in itself then. What about border management? How much blame goes to that? And I'm not talking just about the BMA itself, but the fact that we may not necessarily even know who is coming through our borders, how many of them are foreign nationals, because would it not start there and then end with our health system in knowing who has gone through into it?
Yes, I think both things are important. And if our officials in our health facilities did their job in accordance to the laws of the country, but even after you have given someone care, if they are not properly documented, you need to alert the immigration officers. Now, how can you do that basic function if you are not collecting the basic information of where a person comes from? It means you have no interest in upholding the laws of the country. You are indifferent. The issue that you raise about border management is critical, and they are chronically underfunded. I mean, in the last budget cycle, they needed, 3 billion rands to be able to make their services, to have proper human resources, to be properly equipped to do their job. They were only given about 300 million. So even those structures are being underfunded. We need to ensure that we spend our money in the appropriate places if we're going to make this country work.
I know that you had looked to make hopefully a constitutional amendment change here, particularly for this area. What is that looking like, just very quickly? And I know that that is in your capacity as Action SA, as opposed to just being a Health Portfolio Committee member.
Well, there's a committee that was set up for constitutional revisions in Parliament. And we were supposed to give inputs up until, I think, the end of June. And Action SA has submitted proposals. Now, one of the proposals that would be relevant to this issue is that in Section 27 of the Constitution, where we talk about everyone being entitled to health services, that be specific, that it be to citizens and permanent residents being entitled to healthcare services. We cannot afford to be open to all the 1.1 or 1.4 billion citizens, human beings that are on this continent, or the 8 billion that are on this planet. There's no country in the world that has those kind of provisions. And most of us, having grown up with the Freedom Charter, when they spoke about everyone, I thought they were talking about everyone within the borders. Those that were raised here, those that were born here, those that were intergenerational, but were being denied benefits of citizenship. They were being denied citizenship. Now, if it is now being applied literally as everyone, it is time that we become specific so that it is not subject to interpretation.
Indeed, and I just want to give clarity then that the Section 27 item that Dr. Letlape is actually speaking about then says then, word for word here, that everyone has the right to access to A, healthcare services, including reproductive healthcare, sufficient food and water, and social security. But the question mark is, who is everyone then? Of course, interpreted by different people then, including the South African human rights, as well as others then have seen it in different ways. Dr. Letlape, let's just talk about what is the way forward. Because before continuing to keep people out of our hospitals, tensions are going to arise, and it could then create a bigger skirmish than perhaps we need in this country.
The way forward is upholding the rule of law. The way forward is to ensure that the officials do their jobs properly. The way forward is that the officials have to report people that are not documented, alert the immigration officers, provide them with treatment, alert the officers so that when they leave the hospital, they are handed over to immigration officers. That is the right thing to do. That you will be upholding human rights. And if they do their job, and if we resource the immigration officers properly, if we resource Home Affairs and BMA properly, then things will be done in a humane way and you wouldn't have vigilantism. This is a failure of upholding the rule of law by the authorities. This is indifference. This is apartheid health, where we have put the majority of citizens separate from those of us that are like me and you who can access private healthcare. I ask myself, why, if this is the attitude of the state of being generous to outsiders, they are not taking them to private care? Remember, Arabi, we have food insecurity in this country.
Yes.
We have reports of children that have died from malnutrition in the Eastern Cape. And we now have an open provision in our constitution that says anybody that gets here, we've got to give them water, we've got to give them food, and we've got to give them health services. That is impractical, that is indifference, that is insensitivity to our fellow citizens.
Dr. Kgosi Letlape, I appreciate the time this morning. Thank you so much for joining us.